is there a case of COVID fatigue? I know we talk about the number of increases in infections and death every day, but are people largely not listening anymore like they were 2-3 months ago?
Well, I think that was the reason why we've seen such high numbers, particularly in the South and the West in the United States. But I think, there's a little bit of a shock to the system happening right now, and I think people are getting worried again. So I think we're seeing, people pull back, bars close, even governors who are sort of dismissive now taking this very, very seriously. So hopefully that will, avert the worst kinds of disasters. I just don't know if it's going to be enough to really control the virus anytime soon.
Professor, when you look at, how it's ripping through some of the Southwest in the U.S., is it a little too late to do anything concrete about it, or, to at least reduce the number of fatalities, or can we really put a stop to it?
So it is possible to control. I mean, other countries have been able to control really, serious outbreaks like this, and it starts with, starting to shut down a little bit again, which is what's happening in some places. But then you're going to have to keep that in place for a while so that the virus just doesn't have the chance to keep moving around. And that's what's been really hard for the United States. As soon as you go back from the brink for like a day, people are like, how come we can't do this? And how come we can't do that? And then it's just going to be like a low boil for a long time if we can't really drive the infections down.
Right. Josh, every day there's a different story. Today it is an actor. He is 41 years old, and he's had a terrible, terrible many months battle with COVID and died at Cedars-Sinai in Los Angeles yesterday. He was the incredibly gifted actor Nick Cordero. Great. There's a million Nick Corderos out there who aren't famous. Would you explain to our audience once more that the young are not immune to this virus?
Well, his death really does put an exclamation point on that. I think he's 41 with a 1-year-old at home, and there are many people in that situation. And there's a lot we don't understand about the virus, and there's a lot that doctors who've taken care of patients with the virus say is very scary. And, it is still largely not understood, this disease, and it clearly has serious effects outside the lungs. The lungs are bad enough, but there are major effects in the blood and elsewhere, and that's what, sneaks up on people, and why some people do well and other people don't is just not understood.
Josh, there are two important stories out updating the vaccine race. The Wall Street Journal story is wonderful. It's maybe more corporate, where the New York Times story really dives into the genetics of RNA code that they're trying to find. Are you optimistic that we can use the virology of RNA genetics to get us to a faster vaccine?
So it seems quite likely you can get to a faster vaccine through RNA. The question is whether it will prove to be safe and effective. And there's a lot of hope. I don't really have the scientific background, or I don't think anybody really knows, because it hasn't been studied extensively. But we're going to do the studies, and it's really important that they're done well and viewed impartially, and that the standards for this vaccine are the same as the standards for any vaccine. It has to work. It has to be safe. And so, we'll see eventually whether RNA technology is ready for this, and I hope it is.
Josh, this is really important. I have a clear recollection of antibiotics, of the path from penicillin before me to the various permutations, where it took 5 and 10 years to really come up with antibiotics that had a great efficacy against bacteria. In virology and vaccines, is it right that you don't get it the first vaccine, that what we're really talking about is 3 and 4 and 5 iterations of vaccines till we get a quote-unquote cure?
We don't know that. We do know that many different types of technologies are being tried simultaneously, including some very old types of technologies where you're just killing the virus and giving killed virus to people to create an immune response, and then these new RNA viruses. And then there are a whole bunch of things in between. So it could be that more than one of these work well. hopefully we won't discover that, they wind up making things worse in some way. So that's why we really have to trust the ability of studies to tell us the difference.
Josh, are studies working together? Are virologists working together to get a bigger understanding of exactly what's going on, or is it still each one for themselves?
It's interesting. We have a great number of virologists at Johns Hopkins. One of them, Dr. Pekos, said to me that, pretty much he starts virtually every day talking and conversing with virologists across the world. I think that there is a lot of scientific collaboration going on, not so much inside the specific studies where people have to execute the studies, but as people are really trying to learn about the virus and then interpret the results of the studies. I think that there is. And I think, at the scientific level, people realize that this is humans versus virus, not one country against another.